morning, everyone. We are here with Lucia Pannese, the CEO of Imaginari at Sara Bolla. So, Lucia, I know you're working with serious games and rehabilitation. So, please tell us something about your work and how the two things are related.
Yes, thank you. Good morning, everyone. I'm Lucia. Serious games are digital interactive games for purposes different from entertainment. What we have been studying is, because in the 19 years of company we have been working a lot on EU-funded research, is how to use games to offer particularly tele-rehabilitation exercises.
Okay, thank you. And so, tele-rehabilitation. Can you explain us what tele-rehabilitation is and also what studies have you been conducting?
Yes, 11 years ago we started studying tele-rehabilitation via games, and the idea is that tele-rehabilitation is the phase of rehabilitation when the patient and the therapist are not together, so probably the patient is remotely training on his or her health, and the digital component in the middle has to work asynchronously because it has to respond to the need for a specialist, which is one of the burdens of NHS systems today. So in other words, there are too few specialists and the number of particularly chronic patients is increasing a lot. So what you need is something in the middle, which has to guarantee the quality and the efficacy of traditional therapy. So we have been studying what is being done in physiotherapy, particularly in neurology today. And we have been translating motor and cognitive exercises and stimuli into games that have been designed together with the patients. So we use participatory design to guarantee that specifically elderly patients with neurology pathologies are interested and motivated to adhere to such a therapy.
Okay, thank you. Very interesting. And could you tell us also the benefits for the patients and for the stakeholders?
Of course. Patients can benefit from a therapy from the comfort of their own homes, so they don't have to travel sometimes quite far away to a specialist clinic, which is not always around the corner. They can train at the time they want, so for example, if a manager needs to have some physiotherapy, he or she doesn't need to take some hours of work to be there when the therapists are available. Because of the shortage of resources, sometimes the therapy comes too late because there are long waiting lists. So actually the therapy can start much earlier. So sometimes there is actually a better outcome because the therapy is not delayed, of course. Yeah. So quality of life benefits a lot from the side of the patient. From the side of the NHS system, actually, because of the shortage of resources, you can actually optimize the time of a therapist because they can work with many more patients at the same time because they have to plan for individualized therapy and then check on the progress, but not spend all the time necessarily with each single patient. And then actually also society benefits because people sometimes can stay productive for longer without being being at risk of being excluded from work. Yeah.
Thank you, very useful. And could you share with us what are you working on right now?
Yes, right now we have yet a new EU-funded research project. It's called VR to Care. And the idea is to enlarge a bit the scope of rehabilitation, also with group exercises as well as some monitoring of the patients at home. And Also the context is a bit different because it's not only rehabilitation in the strict sense, but also supported gymnastics and socialization. So we enlarge actually the intervention area where we work on.
Okay, thank you. So I know you also have a website, and the website name is www.vr2care.eu. So thank you for your time.
Thank you very much for your interest. Bye.
Bye.